going to discuss a very important topic that is called how you can optimize your natural fertility. Well, I am Dr. Suparna Banerjee. I am a fertility expert, infertility specialist, and my clinic is Ankur Fertility Clinic at New Alipore, and another clinic is Institute of Reproductive Solution at Uttarpara. Okay, let's see what is the number we are talking here. So 80%, these are all facts, and facts, what I am saying is this is the recent consensus from our group of ASRM or American Society of Reproductive Medicine, where it suggests that 80% of the couple conceive within first 6 months of attempting pregnancy. So if you are not pregnant for 4 months, so do not jump and say, oh, why I am not pregnant, I am trying. Because sometimes you are in a hurry because you have to conceive, pressurized from others, family members, or husband is going away or you are going away for some work, so you want to get pregnant very quickly. So 80% chance you will get pregnant within 6 months, and if you try for 1 year, there is 90% chance you will get pregnant. So even if everything is normal, it might take 6 months to 1 year to get pregnant. Next fact is monthly fecundity is greatest in the first 3 attempts. So it's very important, though I'm saying 6 months, it can take time, you can take time, but if everything is fine, so your chance of conception is most likely in first 3 months. And female age factor is here very important. So when you are in your 20s or 30s, then your chance of conception is very high. It's in first 3 attempts, chance is almost very high, 50% chance. If you are 40, then your chance is already halved. So chance is very low at the age of 40. But that is not applicable for male partner. For them, the age, before 50, most of them hold a quite good sperm number or count, but the sperm parameters declines with age for male as well. So before 35, we get best quality sperm. After 35, the quality declines, but not appreciably till they are 50. Now, peak fecundability or how quickly you can get pregnant was observed when the intercourse occurred within 2 days before ovulation. So, mind it, before ovulation. So, you need not have to have intercourse on the day of ovulation, because some of my patients, they say that, okay, when we say, okay, try this time, and then male partner get very stressed because he has to perform. So it's not the way. So normally your chance of being pregnant, if you try in the window of the fertile period, but most likely before ovulation. So you do not need to check your ovulation every day with your LH, the urine kit, that I am ovulating or not, because even if you do intercourse before ovulation, your chance of conception is very good, and especially 2 days before ovulation, the chance of conception is very good. Now abstinence interval as short as 2 days are associated with normal sperm density. That's why we always say, if you try 2 or 3 times a week, that is 2 days of abstinence in between, chance improve. So do not just count, okay, that day I will ovulate and then I will have intercourse. No, after you finish your menstruation, when you are trying for pregnancy, 2 to 3 times a week, if you try, so in between a short abstinence, then of course your chance of pregnancy is very high in the first 6 months. Now even for the male with low count, then the concentration and motility is highest with daily ejaculation. So do not think, if I ejaculate daily, I am going to lose my count, so that when during time of ovulation my sperm count will not be good. that is not the fact. Fact is saying if you ejaculate regularly, your living sperm or highly motile sperm is, because they are coming fresh from your testis every day, and then your count and motility of the sperm in the semen sample improves. So no point holding it and using it after 7 days, and then your dead sperm will increase and the chance of conception decreases. So even if your count is low, but still do ejaculate every day, that will improve your count, not abstinence. After the intercourse, sperm is deposited in the cervix at mid-cycle, and that reaches to fallopian tube as quickly as 2 minutes, and it goes to the tube which is adjacent to the ovary which is ovulating. So whenever there is ovulation, when you just before ovulation or during ovulation, when there is intercourse, sperm goes and very quickly reaches to the fallopian tube where the egg is there, and the concentration of sperm is mostly there because it is a kind of a chemotaxis happens in the body, so that that egg's chemicals attracts all the sperm and sperm reaches there quickly. Then healthy diet of course is very important, with some vitamin supplements, as your chance of improving the fertility increases with your healthy lifestyle and vitamin supplements, because we all know that whenever we eat, still because of the preservatives, pesticides in the food, we do not get the amount of vitamin which is required daily. So supplement of a multivitamin is very important for both the partner. Smoking, alcohol, recreational drugs, these all cause, along with the pollution, have a negative effect on fertility, which we are seeing now day to day, because it is probably a hazard of our modern life. So whenever possible, try to avoid all this addiction. Pollution you probably cannot, but with our now new normal mask, probably we are avoiding pollution a little bit, but otherwise at least take vitamin supplements, antioxidants, so that your body is in a better position to fight this all pollutant, because you cannot avoid pollution in total. That's all, friends.